Good afternoon, and thank you for joining us for today's Innovation Through Crisis event. I'm your host, Patrick Byrne, Director of Development for Regional One Health Foundation. We're excited to share with you the latest happenings inside Regional One Health Center for Innovation. We hope you find today's program informative and insightful. Before we get started, I'd like to welcome in the Director for the Center for Innovation, Alvarez. And if you're wondering why we're able to sit so close with no masks, it's because we're both vaccinated. So if you have not received your vaccination yet, we encourage you to do so. Ali, welcome in.
Thank you. Thank you. Thank you, everyone, for joining us today. I am very excited to share with you guys what we prepared for you today.
Yeah. To get us started, I'm going to turn it over to the President and CEO of Regional One Health, Dr. Reginald Coopwood.
Thanks, Patrick, and thank you for joining us today. To set the stage for today's conversation, I would like to start with the purpose of the Regional One Health Center for Innovation, and that is to disrupt healthcare. When we started in 2016, we made a commitment to try to figure out where innovation and delivery of care transected. And right there is where we want to put our Center of Innovation, where we were able to align and integrate innovators, entrepreneurs, ideas, technology, and research. I would be remiss if I didn't explain who made this possible, and that is our generous donors, our venture philanthropists. To date, the Center of Innovation has been almost entirely funded through private contributions. And to all of those who have supported the work, thank you. The center would not be where it is if it were not for you. Today's program will highlight why healthcare innovation is essential. You will hear some exciting stories of our internal innovators and our external relationships that we have forged with companies who have come into our organization to learn how healthcare functions. This commitment has continued even during the pandemic, and what you will understand after today's program is that need for continued funding in order for us to be successful in achieving our goals. Now I want to turn it over to Patrick, who will outline what you will see in today's program.
Thank you, Dr. Coopwood. Yeah, during today's program, you'll hear firsthand accounts of how the Center for Innovation is impacting inside the walls of Regional One Health, as well as around the Memphis community. Ali, we have a lot to get to today, yes. So let's dive right in.
Okay.
Our last innovation update was just over a year ago. It's safe to say a lot has happened since then. Can you give our viewers a sense of what it's been like inside the center during the COVID-19 pandemic?
Absolutely. So I'll start by saying, all industries have had to be resilient during the pandemic by either producing new products or figuring out new ways of delivering those products. And the same can be said about Regional One Health. The pandemic has tested our ability to produce, our ability to shift, adapt. But what's been really interesting is that we've seen an accelerated cultural shift amongst our staff. And in turn, that has more than doubled our portfolio size. We went from 5 new projects in 2019 to 12 new projects in 2020. So in essence, we've seen growth here at Regional One Health.
Wow, that's great to hear. So when you say culture shift, what exactly does that mean?
Sure, it's something that's empowering our staff to not only ask key questions like how might we or what if to identify and solve problems, but they're actually taking it to the next level by quickly developing and implementing conceptual solutions to test their idea using the resources they have readily available, including sometimes tapping into the Center for Innovation's framework and services. I can actually say that we have seen the entire organization internalize one of our premier behaviors, which is to challenge the status quo. It's a testament that our innovation competency level is growing, and it's doing so organically.
Yeah. So besides being in the pandemic and in crisis mode, what else can you attribute to this shift?
Certainly. I think I can attribute it to 2 things. One, and the most important, I think, is leadership. They have established innovation as a key strategic priority and a standard of behavior. And secondly, has been our work over the last 2 years, which has exposed the organization to the innovation framework, which is a methodology, but more than a methodology, we've established it as a mentality that requires us to suspend ourselves from reality, as Dr. Coopwood likes to say, and also strive to fail, which is not a traditional way of approaching projects, but that has really worked and generated a lot of traction for us.
So from the increase in internal projects, it doesn't sound like anything's slowing down. What were some of the internal innovations that come out of the crisis that you can share with us?
Well, there's been several of them, but due to today's limitations, I've curated just a couple to highlight as they have been key in the pandemic response. But before I get started, I do want to talk about innovation and how do we define innovation, because that's really going to set the stage for what you're about to see. And innovation is typically, most people will think is an invention, but for us, it's not an invention. Innovation to us is defined as creating a solution to a problem or an opportunity that creates then a new market or a new need. And so keep that in mind as you're looking at these. So I'm going to start with a couple that came from our incident command team. And if you're not familiar with that, that is a group that is activated based on when a disaster happens, or a pandemic in our case, to coordinate behind the scenes any of the response that occurs within the hospital. So I'll start with them. The first example is our curbside pharmacy service. This is a new service created out of the need to lower foot traffic in our outpatient pharmacies to prevent the spread of COVID within our facilities, while still providing an easy and convenient way for our patients to access their medications. Prescriptions are ordered by providers and filled by our pharmacists in the same way as always, but patients get to pick up their medications without leaving their car. We've had such great success with the curbside pharmacy service that it is now available at all of our pharmacy locations. So the need to reduce traffic created an opportunity that is now a new market need. The second example is our COVID digital screening app called the Day Pass. This tool was developed to reduce the burden of resources needed to perform the necessary COVID screening of staff and visitors by eliminating the use of sign-up sheets and then streamlining the process, the COVID screening process. This solution solved a problem that helped us move forward. The next two examples come from employees that are adapting to the challenges of the COVID-19 impact by creating solutions that are helping support patients and their colleagues. The first one I'll start with comes from Jahan Ellis. She is our childbirth educator coordinator. She brought her classes online when the pandemic stopped all in-person meetings or gatherings so that new parents could still get the needed information and support. Ellis already knew the material, so the question she needed to answer was, how can I find a way to deliver this material? And the answer came in the form of a camera-equipped laptop with a conferencing app, something we were already using as a result of the pandemic. She quickly developed a free virtual childbirth education program where new parents could still learn about labor and delivery, newborn care, and even breastfeeding. Soon-to-be parents rely on these classes not only for information, but to ease the anxieties and empower them during an exciting yet very scary time. Jahan identified the need and was receptive to trying something new with the resources she had available. Now, soon-to-be parents don't miss out on any key information and support despite the social distancing guidelines. The next one, which is our last one, but not the least, is our aerosol tent project. This came from our two certified nurse anesthetists, Frank Williams and Mary Conley, who responded to a call to develop an intubation aerosol shield that creates a barrier between the patient and the provider without hampering the provider's ability to render care. Armed with some PVC pipe, plexiglass, plastic sheathing, and a vision of what was needed, they got to work. The tent was used in airway procedures, like intubating patients during surgery or emergency care. These procedures cause respiratory droplets to become airborne, creating the risk of exposure to COVID-19. So the tent was used to reduce the risk of exposure.
Wow, those are great examples of innovative solutions to pandemic problems. Regional One's a large healthcare system, over 3,000 employees. How were you able to connect with these individuals, these opportunities?
Well, the short answer I would say is access and great user experiences. But really, it's been word of mouth promotion about our framework and our user experiences that have generated a lot of inquiries for help, inquiries for wanting to participate, inquiries to just wanting to learn more. And that actually gave us insights into what all was happening across the organization, which then inspired a lot of our programmatic efforts. For example, last fall, we launched Innovator of the Month, which is a program that we use to highlight and promote and recognize, individuals that are coming up with innovative solutions or challenging the status quo. It's our way of generating exposure, but it's paid off. Not only do we encourage others to nominate their peers, but we also investigate, interview each and every one, so that way we learn about their innovations, but we also introduce ourselves as a way to help them scale if needed. And I do know our most recent winner, Karen Maestri, is here with us today. She was the winner for February's Innovator of the Month.
That's right. We're excited to welcome in right now Karen Maestri and Charles Lapsley, Nursing Director for Trauma, Emergency Services, and Critical Care. Karen and Charles, thank you for joining us.
Thank you.
Karen, we'll start with you. I understand you are very familiar with Regional One Health. Can you tell our viewers a little bit about yourself, your role, and your time here at Regional One?
Oh my goodness, it's been so long. It's been 40 plus years. I started as a nurse extern back in 1980. When I graduated in 81, I started to work in the neonatal ICU. I spent 5 years there. Then I moved to the Byrne unit, and I was there for around 25 years. When I left the Byrne unit, I went to the trauma division, and I've been in the trauma division and some in the trauma ICU, most of it in the trauma registry.
And I do want to point out that the reason why Charles and you are able to sit so closely is because you two both are also vaccinated as well. So I just wanted to point that out to our viewers. Charles, I understand that Karen's manager and yourself nominated her for this recognition. Can you tell our viewers a little bit about why you nominated her and what you nominated her for?
Sure, Patrick. Well, I meet monthly with my reporting managers for a roll-up summary. And Pam Finney, who's the trauma program manager, informed me that she wanted to nominate Karen for the Innovator of the Month based off a virtual training platform that she developed. When we sit back and we think, why would Karen create this platform? It was simply because, unfortunately, we'll say this, her readiness for retirement. As she stated, she's spent over 40 some odd years of dedicated, loyal work with Regional One. And here it is, she's succession planning. She wants her team to be able to have the jewels and the wealth of knowledge that she has. So she set up this platform to ensure that her team was going to be able to write reports, as she so eloquently speaks about how she loves reports. But this is a needed component as we look to elevate our trauma program and shoot for the stars. So this is the why behind why we nominated Karen.
Well, after 40 years, I think retirement is well deserved. Charles, what does it mean to you to be able to nominate Karen for this type of recognition?
Well, I'll say this as a leader, there's not much more joy that can come to a leader being able to recognize team members for their individual contributions. I feel that it is imperative and is of the utmost importance to recognize that behavior, because we want that behavior to be modeled. So anytime we have the opportunity to recognize individuals, that's what we need to do. And I'm so thankful for the Center of Innovation to provide that platform for us to do so.
And Karen, what does it mean to you to be nominated and selected by your peers as the Innovator of the Month?
I think it means everything. Everyone wants to be appreciated. The people at this hospital work very, very hard, as I'm sure everyone knows. And to be recognized and to know that you're valued, it's just so important. It is so important. I can't even stress it.
Well, Karen, congratulations on being recognized as the Innovator of the Month. And I want to thank you both for taking time out of your day to join us.
Thank you.
Thank you.
That's a great way to recognize innovation. Look forward to seeing who's selected the next Innovator of the Month. Looking, at the shifting gears, your team, you make up 1/3 of your team. I mean, not a lot of people probably know that. Yeah. It's not like you have a huge staff, right. But you were able to make your first hire last fall, and Alex Horn, who's your project coordinator. Talk a little bit about Alex's impact as well as your team.
Yeah. So yes, I desperately needed some help. And as you can see, our workload increases every single day, which we love. We welcome it, and we're excited to be able to do that. But yes, Alex joined us back in November, and she's made a tremendous impact on our throughput already. You know, she's helped us scale some of our engagement activities, as well as like Innovator of the Month, as well as take on new projects. And so she brings a lot of fresh perspectives, new energy, which is crucial to the work that we do. So we love having her for sure. Certainly I do. But, you know, someone else who's been key to our throughput has been Juwan Moore. He is our software developer resident who came to us from Code Crew. He's been with us for over a year, and he has been crucial in scaling a lot of our software development projects, like a medication titrator, and we're also working on a documentation tool. So he too has been critical to our success.
Yeah, well, sounds like the extra help is really paying off.
Yes.
When you were talking about Juwan, you mentioned Code Crew. Tell us about those types of partnerships y'all have.
Certainly. So an underlying objective that we have for the work that we do is to help build the Memphis ecosystem. And we do that by doing something we like to call building high-performing partnerships. And so these are partnerships between two organizations that are mutually beneficial in advancing our mission, and which in turn help build the Memphis ecosystem. So it's a win-win for both organizations.
And speaking of partnerships, this time we're excited to be joined by Erin Johnson with Code Crew. Erin, thank you for joining us today.
Absolutely. It's great to be here.
Hi, Erin.
Hi.
Can you tell us a little bit about Code Crew, your role in Code Crew, and then how the Center for Innovation plays a role in what you're doing at Code Crew?
Absolutely. So Code Crew, our mission is to educate, mentor, and train those most underrepresented in tech to be tech innovators and leaders through hands-on computer science training. So we are a nonprofit, and we have been around providing computer science education in the K-12 space since about 2015. And we started with kids, and in 2018, we increased our reach to include adults through our coding bootcamp. So I am the program director for Code School, and our mission is to diversify the workforce and the tech ecosystem in Memphis. So there's definitely strong alignment and a mutually beneficial partnership. I've been just really grateful to work with Ali at the Center for Innovation, and there's definitely a lot of alignment in our mission and goals through just innovative partnerships, employer partnerships for graduates of our coding bootcamp.
Yeah.
Erin, what's your experience been like working with Ali and her team, which now includes one of your former students? And where do you see the partnership going?
Yeah, it's been delightful to work with Ali, just because I see this employer partnership as being most innovative, because we meet bi-weekly to make sure that everyone is on the same page, making sure that what the Center for Innovation needs, their needs are being met, making sure that Juwan's needs are being met, and then also thinking about how we can, how our partnership can evolve. So we definitely see it evolving as hiring more developers and being able to have our developers come work at the Center for Innovation.
Yeah. Well, we're excited about the partnership we have with Code Crew and look forward to its continued growth. Erin, thank you for joining us today.
Thank you.
And for one partnership to another, here's an in-depth look at the collaboration between the Center for Innovation and the Gadomski Center for Engineering Innovation at Christian Brothers University.
It was about this time last year, we were quite abruptly told, you know, you're going to be leaving campus for a while. And I think there was a lot of us that thought, 2 weeks. And 2 weeks went by, and now the thing is, well, we've got these students that can't go home. They're either from other countries or other states, and they're, for all intents and purposes, stuck here in limbo on campus. We used some of the funding to buy 9 or 10 low-cost 3D printers, and we had this little machine going, cranking out face shields. We had some contact with Ali. She'd reached out to us, and yeah, we can do that. Happy to get you a crew of 4 senior design students. Yeah, we're working on an idea that was brought to us by Regional 1 to cover patients while they're being intubated. Project requirements are that it's light, clean, foldable, and the students are now working on, in particular, the mechanisms to make that.
I have been working on the intubation box. It's been an amazing experience, and right now we are currently working on the second prototype. I never thought freshman year that I'd be working on something that could, help save thousands, if not millions of people. And that's just an incredible honor to be working on that project, and also to be working with such great people on my team and also at Regional 1.
You're focusing on something small, and what happens is you wind up coming up with something big and focusing on something small. And we were able to make, for a small university and a small engineering department, we were able to turn out on the order of 4,000 of these. Perhaps most importantly, gave these students a sense of purpose and motivation. Motivation that their career could be about something, very worthwhile and very impactful.
Wow, it's great to see two Memphis institutions working together in that way. What do these partnerships provide you all at the center, and how do you see them growing in the future?
Certainly. So besides building the Memphis ecosystem, for us, these partnerships help us fill in gaps in expertise. So for us, it's really difficult to pre-plan who and what we will need because we don't know what ideas or challenges are going to come to us. And so as these are subject to, what's happening in our surroundings. And so having partnerships like that we can activate based on demand or need is crucial to our model. That helps us continue to move forward without having so much, of an expense up front.
Yeah. And at the end of today's program, we will share with you how you can help connect Allie to partnerships like these in the community. We'll look forward to sharing that with you here in just a moment. But right now, we'd like to introduce two bright minds whose businesses are working with the Center for Innovation through the Access Incubator program. And in case you're wondering what's an Access Incubator program, it's a program that provides startups and entrepreneurs with access so they can validate their business or clinical case innovations, and in this case, in a healthcare setting. So that being said, we are excited to be joined by Kayla Graff with sweetbio. Hey, Kayla.
Hello.
And Ashley Moy with Cast 21. Hey, Ashley.
Glad to be here.
Thank you for joining us. To get us started, if you would just provide our viewers with a brief overview of your business so they can know a little bit about what you two are up to. Kayla, we'll start with you.
Sure. So I'm Kayla Graff, CEO and co-founder of sweetbio, and we're a Memphis-based medical device company that is leveraging Manuka honey to bioengineer products that bring a healthier tomorrow. So for us, that means using Manuka honey in wound care products to help heal some tough wounds like diabetic ulcers, venous ulcers, and surgical sites like those that are caused when you're removing skin cancer. And we've been a 6-year journey from idea all the way through FDA clearance and now early commercialization.
Yeah. Excellent. And Ashley, can you tell us, our viewers, a little bit about Cast 21?
Absolutely. I'm Ashley Moy, the CEO and co-founder of Cast 21. We've created these waterproof alternatives to casts and braces for people with broken bones. Our co-founder has actually been in over 60 casts and braces in his lifetime. So when we set out to develop something better for the patient experience, we actually found that there were a lot of inconsistencies in the clinical care as well. So we developed something that was waterproof, lightweight, and comfortable for the patients, but also more efficient and safer for the healthcare providers.
Wow.
Absolutely amazing, right?
Yeah. I've been in one cast and that was enough for me.
So ladies, tell us how you learned about the Center for Innovation and more importantly, I think, why Memphis? I think those two sometimes are not related in healthcare conversations. So Kayla, we'll start with you.
Sure. So, I've kind of moved halfway across the country multiple times and started sweetbio in Memphis after moving from San Francisco because of the diverse and rich medical device ecosystem here. But what's critical once you get past that startup phase, how do you understand regulatory? How do you get packaging down? How do you make sure that you have something that could be sellable? It's really uncovering what the commercial landscape looks like. Where do you add value? Where are you differentiated? And so when we were looking for how can we better understand where we fit in this marketplace? It was very clear that the Center of Innovation and Regional 1 being such a hub across multiple specialties could really provide some insight and de-risk as we start scaling.
For CAS 21, we came to the Memphis area through the 0 to 510 accelerator, which is one of the best medical device accelerators for early stage companies in the country. We had actually connected with Regional 1 Health through that accelerator program. And this was years before the Access Incubator even existed. Somebody had made a note about CAS 21, and when Allie was hired, she reached out to us and said, so somebody has mentioned CAS 21 to us, and she shared the Access Incubator and what their mission was with us. And it was truly a win-win for both of our organizations, for CAS 21 to really go out in the world and have this Access Incubator be the first opportunity that we do a controlled clinical investigation with our work, and also for the Access Incubator to work with their first external innovator in a low-risk opportunity.
Of last year, what has this past year been like for your business? Ashley, we'll start with you.
This past year has certainly been a roller coaster, just to put it simply here. It's been so crazy with the supply chains and healthcare industry, especially our area being orthopedics. A lot of our customers saw a pretty big drop in the number of people who were having their elective surgeries. What was really interesting for us is when we had a lot of big trends where people were hoarding things like toilet paper, we decided to change our buying patterns and raw materials to make sure we could still deliver what we needed to for all of our partners.
And Kayla, what's it been like at sweetbio over these past 12, 13 months?
Yeah, I think roller coaster is an appropriate term. We had planned to launch our product in March of last year, and our first market was hospitals and operating rooms. And as many of you know, in the very appropriate and necessary situation, hospitals need to refocus their efforts and their resources on helping provide treatment for COVID patients. And so we took the opportunity to normalize and stabilize and listen, and in true startup fashion, understand where the market was headed. Our first industry is wound care, and wounds, unfortunately, are inelastic during this time. They're still occurring, especially in diabetic patients and the elderly population. And so we took the opportunity to learn from experts to say, what's happening with home care? What's happening with virtual? Where do we fit in? We designed this easy to use, simple product off the shelf ready. How could this be applied in what is becoming a new normal for healthcare? And through that, we've created new business models, forged new partnerships, and deepened our relationship with Regional 1 as we continue to treat patients and really get that valuable data to see, again, that value proposition of where we fit and now the new healthcare normal and wound care.
Yeah, so it's been also resiliency that you two have demonstrated as well. So resiliency across the board. So congratulations on continuing your work and not letting this pandemic, turn you down, basically. So ladies, I have to ask, has the pandemic affected our relationship with the Center for Innovation of Regional 1 Health?
We'll start with Kayla.
Sure.
Yeah, sure. No, I would say that our relationship has deepened in this process. I mean, trying to understand how you treat these patients that need this wound care regimen. I mean, it's just a necessary treatment. And so for us, I know our Chief Science Officer, Dr. Isaac Rodriguez, has been meeting with you, Allie, every single week and designing, what does the next stage look like? How do we analyze this data that we're looking at to drive insights? I mean, it's been so beautiful to see the patient population at Regional 1, which is unique and raw and real, and to test the boundaries for us of what is the product doing, what is patient compliance doing, and how can we make sure that we are meeting the patient where they are and really bringing value to you and them at the same time. So I've seen our relationship deepen. I've seen such fantastic results, and the partnership has been extraordinary. So we're very appreciative that while we know you've been dealing with so much at the hospital, that you continue to invest time in us and really even strengthen that partnership.
Thank you. And what about you, Ashley?
COVID has certainly not negatively impacted our relationship at all, which we're very grateful for. There was at no point that we dropped communication or stop anything we were working on together, which was fantastic. We did have a couple times where we rescheduled some of our meetings so that everybody at Regional 1 could focus on their COVID patients, but we wouldn't have had it any other way.
As you both know, funding is critical to the work that Allie and her team are doing. What would you say to someone who might be on the fence about supporting this work? Ashley, we'll stay with you.
To anybody who is considering donating to this work, I would say that you will not have any doubt that your money is making a positive impact, not just at Regional 1, but also at Memphis, the community at large, and all around the country and even the world. For our little example with CAS 21, working with Regional 1 as our first opportunity to get our product on the patients has now blossomed into this experience where patients, not just at Regional 1, get to use our product, but all of the major orthopedic centers and community health networks in the Memphis area are using it. We have almost 24 different states in the United States that are now using our product, and we've started to export to other countries and even overseas. And this would not have been made possible without Regional 1.
And Kayla, what would you say to someone who's interested in supporting this work?
Yeah, I mean, that was beautifully put. Any dollar that can be put into this effort will be multiplied exponentially. Our ability, Ashley and I, we are fueled to bring our technologies to people. We are fueled to have a healthier tomorrow. And this access point for us is such a critical on-ramp to getting to the millions that we hope to reach. So it's not just, a dollar you put in is a couple dollars that you get out. You have us leading a charge on companies that are bringing critical innovations to the market, but we need this support to be able to crack into it. And so please consider it, because having this touch point, having access not just to data of how the product works, but how does billing work? And can we ask questions on how inventory is stored and how it's tracked, and really important raw feedback we can see by just being there. That is just not something we get in any other city. So I want to see our startups succeed. I want to see this entrepreneurial ecosystem, especially in healthcare, succeed. And this is one very important way to make it happen.
Yeah. Well, thank you both for those comments, and thank you both for joining us. We're excited about the partnerships we have with each of you. Look forward to seeing your continued growth over the coming weeks and months, and hearing from you again at our next innovation update. But thank you, Ashley, and thank you, Kayla, for joining us today.
Thank you.
Thanks for having us.
Thank you.
From everything we covered today, it's pretty clear that healthcare innovation is needed more than ever, and a center like ours can really push innovative thinking, innovative approaches, innovative solutions. So earlier we talked about the partnerships. So if someone's watching today would like to connect you to a potential partnership, one, what type of partnerships are you looking for? And then how would they connect with you?
So there's two types, I would say. Obviously, if you're a healthcare innovator, we'd love to hear from you. If you're a startup or an entrepreneur who needs access, our Access Incubator is here for you. So we definitely want to hear from you. If you are a high performing partnership, then we'd love to hear from you as well. As you heard from earlier, building high performing partnerships is important for us because they fill a gap in expertise that we can't support either with a full staff or a team. So this partnerships helps us advance in whatever we've got going on without having the need to bring in a whole team. So activating those is extremely important. So if you know someone or you are one of those partners, please reach out to us. And so either way, you can connect with us at our webpage, innovation.regional1health.org, or email me directly at innovations@regional1health.org.
And as Dr. Coopwood mentioned in his opening remarks, the Center for Innovation has been almost entirely funded by private contributions since its inception. What are some of the ways those dollars can be utilized both in the near term and long term?
Certainly. So donor support is critical to our success. Funding helps us recruit more healthcare innovators, helps us fund new and current staffing members, and also to acquire any new technology, equipment, or just resources to help with prototype development and inventions.
Yeah. So last year's innovation event, we launched the Innovation Growth Fund to provide support for these things that Allie just described. We set a goal of raising $125,000 by June 30th of this year. Because of the pandemic, we have seen a dip as other needs have arisen, that have been addressed, and we're grateful for that support. The Center for Innovation has seen a dip. And so as of today, we're only about 40% of the way towards that goal. So we need your help closing that gap. If you are interested in supporting Allie and her team, supporting this work, and providing more opportunities both inside the walls of Regional One Health and to external partners like sweetbio and CAS 21, I'd love to talk to you. My information's on the screen. Email address is there. Feel free to shoot me a message. Love to connect with you by phone, by Zoom, whatever works best. But love to talk about ways you can help us support Allie and her team in these efforts. And before we wrap, Allie, I want to just thank you and your team for all the work you've done over the past 12 months and continue to do. It's pretty amazing.
It's been exciting.
Yeah. And I want to thank our guests who joined us. Appreciate everybody taking time out of their schedules to be a part of today's program. And want to thank everybody behind the scenes who helped make this event possible. And of course, want to thank all those who tuned in. Thank you for joining us for today's Innovation Through Crisis event. Have a great day.